I'm Dr. Lincoln Sargeant. I'm Director of Public Health for Torbay. I'm taking over from a distinguished colleague, Dr. Caroline Dimond, who retires at the end of the month. Dr. Dimond has been the public health lead for the COVID response and has been the face that you've been accustomed to over the past many months as she's given updates as to the situation with cases in the Bay as we've continued to fight against this virus that has taken over so many aspects of our lives. Dr. Dimond leaves a legacy of a strong and motivated team, and also many public health foundations have been laid for us to continue to build on as we continue in the fight against COVID. It's therefore my real honor and pleasure to be taking over at this time. We heard this week the Prime Minister outline the program, as it were, the roadmap out of lockdown. And as we enter the next few months, it's important to recognize that nothing has really changed about how this virus spreads, and therefore the public health response to it remains the same. Even as we are encouraged by the vaccine program, by the numbers that have been vaccinated so far, and we are looking at approximately 1/3 of the adult population, certainly most of the vulnerable groups, those over 70, those who work in health and social care, the vast majority have been vaccinated, and the program is now beginning to pick up those who are in younger age groups and who have particular clinical conditions that make them at risk for severe illness should they become infected. That becomes a game changer. Alongside vaccination, with other public health measures, we have the tools to maintain very low levels of COVID going forward. However, we need to maintain and we need to ensure that the rate continues to decline. In the last week, we continue to see a fall in the number of new cases of COVID that we see in the Bay. We continue to see a fall in the number of hospitalizations. We continue to see deaths decline. However, the rate of decline is slowing. We're beginning to plateau, and we're certainly not decreasing as quickly as we would like. It's important that we get those numbers as low as possible before schools begin to reopen, before other aspects of the economy reopen. The lower we get the numbers, the greater our chance of keeping them low and of allowing our economy to reopen, allowing us to welcome visitors once again to our beaches and to the beauty that is in the Bay. Many people have been vaccinated so far, as I've said. They've had at least one dose of the vaccine. And it's important to recognize that it takes time before there is a full immune response, before people are protected, having had their first dose. The program will now begin to call back people for their second dose, which will ensure that there's a boost to the immune system and that they can fight the infection. In the meantime, it is important that people maintain vigilance. Even if you've been vaccinated or even if you've had that first vaccination, you're not yet fully protected, and it's important that you maintain social distance, that you wear a face covering as required by law and by the situation if you can't maintain social distance. Also to wash hands frequently. We know that many people with COVID do not have symptoms or do not have typical symptoms. perhaps as many as 1 in 3 can infect others without knowing it. So it's important that people not just wait to, or not just be suspicious if they have the typical cough or fever or loss of the sense of taste and smell. COVID may present with very mild symptoms. For some people it is simply a headache. For some people it is just feeling possibly unwell. So it's important that if you feel ill in any way, that you immediately isolate and get tested, and that if that test is positive, then you continue to maintain isolation for 10 days, that you identify any contacts to test and trace so that they in turn can be followed up, and so we can break the chain of transmission from one person to the other. As a council, we have been working to support people to self-isolate in practical ways, as well as helping with the financial grants that are available to help certain categories to maintain that isolation if they test positive. And it's important that we continue to do that. It's working together in these ways that we can ensure that our children can return to school, that our economy can reopen, that we can meet the roadmap that has been set out safely, and that we do not risk cases beginning to rise again that would cause us to interrupt the progress that has been so hard won. Let me end by thanking the efforts of so many, including the residents in the Bay who have sacrificed a great deal to ensure that they and their neighbors and their families remain safe and well, and to encourage us once again to do what we can in terms of maintaining social distance, having our face coverings at all times, that we are out and about and cannot maintain social distance, and that we wash our hands frequently with soap and water for at least 20 seconds. Thanks.